What can vaccine distribution teach us about the future of healthcare? Hey everyone, welcome to Healthcare at the Edge, where we explore the intersection of healthcare and technology. My name is Samuel, and today I want to talk about logistics. It is a boring topic to be sure, but it is one that I think is going to be very important to the future of healthcare, especially as more and more care is delivered in distributed models. We think about it. Historically, the model of healthcare delivery has been come to the doctor's office, come to the hospital, go to the clinic, go to where the care and expertise is. And while that model will not go away because there will always be a need for, very advanced or specialized treatments that can best be delivered inside of a critical care environment or a surgical area, those type of things, the future of healthcare is, in my opinion, going to be delivered at home. And so that brings me to the conversation around the distribution of the COVID-19 vaccination throughout, the United States here. It has been a mess. I think we could all agree, no matter what you think about the vaccine, whether you will get it, you won't get it, whatever your opinion is, it's been a mess. And the reason why has just been some basic blocking and tackling, logistics, communication, just the stuff that goes into scheduling and allowing people the easy access to get the vaccine should they want to. And so you look at companies that are really good at vaccine. It was actually encouraging to see Amazon sending a letter to President Biden and say, we want to offer our support. Amazon is experts at logistics. I mean, you order something on Amazon Prime and they're knocking on your door 5 seconds later, it seems like, to deliver that package. So they're good at it. They know what they're doing. They know how to move stuff around our world in an efficient way. And so when it comes down to delivering care in a person's home, there are a lot of factors that go into it. Namely, are your providers going to be comfortable managing a patient's condition in their home? So many doctors have been trained to care for and heal patients in a hospital environment only. And that's what they know. They're good at it. They're expert at it. So getting them into a home-based healthcare model will be a bit tricky. The second piece is, what do you need in that patient's home to deliver care? Do you need special monitoring equipment? Are there other medical devices that will be needed to provide care? How will you manage medication delivery and reconciliation? Did the patient take the medicine? Did they take the right dose? Did they take it at the right time? What else is needed? How will you manage getting maybe some skilled nursing or somebody that's a helping hands or a visiting nurse or somebody to come visit this patient to provide them either updates or check in or all that stuff? How will you incorporate, telehealth, telemedical technologies, whether it's a video visit, whether it's some type of reporting back from those devices and wearables that are in the patient's home back into the electronic health record so they can be reviewed? Are you going to need to provide some type of continuous monitoring, whether it's for a core vital sign or a key piece of information? What are these things that are going to be needed in the home? Now, all of that will require logistics. You've got to ship the device, those things, that information, whatever it is, you got to ship it from where you have it to where that patient is in their home. I personally think some of the best healthcare is ahead of us. We're going to see a rapid shift to a great model where people are going to recover, recuperate, and receive healing in their homes, which is a wonderful place to be. It may not know this, but actually one of the most dangerous places to be is a hospital. Your rates of infection, a hospital-acquired infection, is actually a significant problem with long-term stays in hospitals. All sorts of issues, medical errors compound as you're longer in the hospital. There's different pieces. So getting patients out of the hospital and into the home will be a key to long-term health effectiveness and better care outcomes, I think, for many people across our world. So we have to take the learnings of the COVID-19 vaccination rollout and the messy logistics, the inefficient and poorly done logistics across many systems. Now, there are some that are doing it well, and I'm not going to throw them out, but overall, it's not gone according to plan or to speed. So We got to learn these lessons well. We've got to understand and figure out how do we do this better so that we can eventually move into the future where we're delivering care in patients' home effectively. Hey, let me know what you think. I can't wait to hear your comments, concerns, challenges, or critiques. And we'll see you tomorrow.